everyone. So I've been thinking about how I kind of wanted to do a video like VBlog about what it is, like what's going on with being able to provide reproductive health, gynecology, abortion care in our outpatient clinic setting, and what the impact of COVID-19 has kind of had on both, people working on the front lines, seeing patients still, and also the toll that it's kind of been taking on patients. So, good news for the moment. Holman's Health of Baltimore is still able to provide most of our services to people that need to come in and see us. And we have put a lot of really kind of thoughtful measures in place to both, increase safety for not only patients, but our team. Also, we're trying to see people while we still can, right? So the thing with pregnancy, people that are pregnant, that's like a time sensitive thing. So when there's a delay of care, when there is difficulty or challenge in getting care for pregnant people, both for folks that are going to be continuing their pregnancy and also for people who are not, when there is a delay in care, it can cause really, really bad negative impact for people. Let me also preference this video by telling or reminding everybody that my role in our clinic is patient advocacy, patient counselor, and I do a lot of our community outreach and education. So I'm not a doctor, make that clear in case this gets shared with other people outside my friend circle, which is fine. But yeah, so a couple of observations that I've had that I wanted to share with people. Our patients have been amazing. They have been so beyond wonderful and grateful and just doing everything to the best of their ability, not only to be careful and safe for themselves and for our staff, but looking out for other patients as well, which is like amazing. Our staff, every day it's almost like we kind of come up with new ways that we can like do even more, right, to protect and provide even safer care. I found myself this past week, like tweaking things as I was going along to be like, okay, maybe we could do this or we could do that, and it might cut down again on exposure to COVID-19, right? Yeah, so the other thing that I noticed yesterday that I wanted to share with you all, one of the things we do is we call our patients usually the next day after they've come in for care, and we call them because we want to check in and make sure they're doing okay, right? So I noticed like yesterday when I was calling patients back who had been in the clinic on Friday, it was really depressing phone calls. Patients were, doing well medically, right? Everybody was in good shape, but it wasn't like normal callback. It was, yeah, I'm finding out how they're doing, but man, like it was pretty much every phone call so depressing. People are just so scared. They were so appreciative that we saw them. And they're just, some of them are just having a really hard time managing their pregnancy or managing post-abortion care or managing taking the medical abortion pills at home and self-managing that with everything that's going on, right? Because the fear for people is if they have an issue, what would happen if, they try to go to the ER or they can't get to a pharmacy to get medication, or they run out of like essential items that they need for hygiene, or they come down with COVID-19 and don't know the difference between, are they seeing symptoms that are similar to the flu? Are they similar to, how they've been feeling with allergies? It's just like very, very complex conversations. And just like reassuring patients like, hey, like, we're here for y'all, right? So, I just thought I'd share that with you. Like, most of the time when we call people back, they're like, yeah, I'm doing good. Like, everything is good. No questions about the day before. Or it's like stuff we can triage really easily. Yesterday, like, I was like, I was ready to cry with some of these patients over the phone. They worry that they're putting their own family at risk too because they left the house to come get a necessary service. And the other thing I want to talk about with this is, like, pregnancy is a really, really time-sensitive thing. So you can't just say to somebody, oh, like, 3 months from now we can, see you for whatever. It's like decisions have to be made, like, now. So I just wanted to say, like, at Whole Woman's Health, we are, doing our best to make adjustments that will allow for us to continue to see people, because I want to make sure we can do that. The company wants to make sure we can do that. Our team wants to make sure we can do that. Our doctors want to make sure we can do that. But also while honoring, safety and health for all of us that are working there. Yeah, so I just want to also say that, this work that we do is, like, super important, but it's also super important right now. So when states start restricting access to healthcare, it trickles down into things like what we do, right? So I just want to put that out there that we are really trying our best to continue to see patients, to continue to see them safely. We are trying our best to make sure that we are trying to keep it together for our team. I can tell you right now that I personally could not be getting up every day to do this work if it were not for my co-workers and our bosses at the Baltimore clinic. No way. They have been so amazing, super leadership, trying to make sure that they're doing everything they can, to make sure we can come in and do what we need to do. So yeah, I just wanted to say all of that. And I hope that folks will take this more seriously. Unless you are working or picking up supplies, and I mean, like, supplies like you need food, groceries, sanitation stuff, hygiene stuff, prescription medication, that kind of supply. I do not mean going to a bunch of stores to buy random crap. Oh, and the liquor store definitely needs to be on the list of necessary supplies. But you get my point. Like, I know people are going stir crazy and freaking out, but being out in the community, being around a bunch of people, taking risks, even if you personally, right, like, don't have an issue, you don't come down with it, you cannot, or you should not, risk other people getting sick, right? So, some of us, we're getting up, we're going to work, we're doing what we can to support our communities. Please, people, please, for the rest of you, stay in your house, or at least stay away from people. No kids should not be coming over and playing with one another. No, it should not be treated like some extended spring break. I know y'all have already heard all this, but I'm telling you, it is true. Every single one of us working in healthcare are going to tell you the same thing. Stay home. Anyway, in conclusion, for the moment, I want to thank everybody who has, reached out to our group at the clinic, showing support. The community that we work in is amazing. Y'all have been incredibly kind, incredibly gracious, incredibly helpful, working with us to come up with creative ways that we can still, do this work. So thank you for that. And also, if anybody has questions about abortion care related issues or pregnancy related issues, GYN care related issues, access to things that you all need, if you need birth control stuff, if you need morning after pill plan B, condoms, whatever the situation is, don't be scared to reach out to me. If it's for you, if it's for somebody else, let me know so we can see what we can do to help people out. And I'm going to try to continue to update how things are on the ground, since we're working on the front lines with all of this insanity. So, thank you all for listening, and I appreciate your support, and hang in there, folks.